You're listening to the Inflamed and Exhausted Podcast, the show for women who are tired of being tired. I'm Lieah Torbert, CEO and co-founder of Wellness by Davlie, and I've been where you are, burned out, foggy, and wondering why my body couldn't just bounce back like it used to. On this podcast, we'll uncover the real reasons behind your fatigue, inflammation, and hormonal shifts, and I'll give you practical tools and guidance to support your body, restore your energy, and take back your health, one small step at a time. Let's get to it. Hello, everyone, and welcome back to Inflamed and Exhausted Podcast, where we're talking about all the reasons why we just don't feel like ourselves and our own bodies. We're getting older, we're tired, we're cranky, things just don't seem to be working right. And sometimes things just feel a little bit harder than they need to. And so that's what we're talking about on the podcast today. I have a very important guest, Dr. Jacinta Anyaoku, who is a double board certified physician in family and obesity medicine with advanced training in medical aesthetics. She's been practicing medicine in the Houston area since 2014. And in 2021, she founded Hibiscus Aesthetics and Wellness in Katy, Texas, which is my backyard. So Dr. Anyaoku has a focus on natural results, personalized care, and patient education. At Hibiscus Aesthetics and Wellness, she combines science and artistry to help patients feel confident in their skin and achieve ultimate wellness. Outside of her practice, she is a wife and mom of 2 boys, a community leader, and a lover of travel and Houston's vibrant food scene, which we have so much food to take advantage of here. I love it. I love it. So welcome to the show.
Thank you. I am very excited to be here.
So for the audience, Dr. Jacinta and I recently got to know each other through a networking group that we're both a part of. And we connected, and I thought she would just be an amazing guest for the show because she is a specialist in GLP-1 medications. And I know there's a lot of questions out there. There's a lot of information, good, bad, people using them correctly, incorrectly. So I wanted her to come on the show and share with us her experience and how she's using GLP-1s to help her patients. But before we get to that, I'd really like to dig in a little bit and let the audience get to know you. So could you tell us a little bit about why you chose to specialize in family and obesity medicine?
Yes, definitely. So, when I was going into med school, I actually went with the intent of being a dermatologist. So I loved skin, loved skincare, and that was my passion. And it wasn't until the 3rd year of med school and I did a family medicine rotation that I realized I actually loved family medicine too. I love being able to treat the whole person. So with family medicine, I got to do the dermatology care as well as treat the high blood pressure, the diabetes, get to know my patients' families, their kids, treat the whole family. So that really appealed to me, and I pivoted and decided to do family medicine. So I've been practicing family medicine now for 15 years. Yep, 2010 was when I graduated from med school, so it's been a while. And as much as I love primary care and finally and family medicine, I started to realize that after I opened this practice and the whole past few years, weight loss has been a really big thing. I started having a lot of weight loss patients coming to my practice. And so that just really by accident became a big part of my practice. And so I decided to learn more about obesity so I could better serve my patients. And I studied, took courses, and got board certified in obesity medicine a couple years ago. And so now that I have that, my practice has really turned to a focus of the obesity care as well as medical aesthetics. So I've kind of come full circle with my dermatology passion, and I do a lot of skincare here, a lot of anti-aging skin rejuvenation treatments, but I still get to practice my passion for treating the whole patient and treating conditions that not only affects just one organ, but weight is something that really affects all aspects of your life. So yeah, that's why I ended up specializing and I love it.
I love that. And it really ties everything together because we get to be very self-conscious. So if we have the skin conditions, the acne, any of those other things, we're already more self-aware than we probably should be. And then if we're suffering from weight conditions as well, that puts a lot of mental burden on us. And so I love that you're trying to help the whole patient. It's just wonderful.
Yes, thank you.
So I know you've made this transition and you've been working with patients for a while. So what do you think most patients should understand about that connection between their weight management and their overall wellness that you see a lot of your patients missing?
Yeah. So, weight and just obesity in general is very complicated. And even those of us who are physicians, we honestly don't learn a lot about that in med school and residency. It's not until you take that time to specialize, such as getting a board certification in obesity, that you really start to learn about the underlying mechanisms and pathology that comes along with having excess weight. And to the point where it leads to a lot of inflammation, which is the source of a lot of chronic conditions that people suffer
Mhm.
with. So, what we find is that once you start treating the weight, then a lot of these other things start to improve. So, a lot of times, patients and society in general, they look at weight as almost a cosmetic thing. That's even why insurances are still struggling to cover weight loss medications because it has traditionally been considered a cosmetic problem, when in reality, it's a medical problem. It's a medical condition, just like diabetes, just like having high blood pressure. It is a chronic medical condition. And so we really need to start looking at it that way. And once you do, then your mindset changes because you're not looking at it as, oh, I just need to lose weight so I can fit into these clothes, or, I
Mhm.
can look good for this event. You really want to lose weight so that you can prevent chronic conditions from happening in the future, or you can actually treat some of the medical conditions you're suffering from now. That's really the goal of the weight loss, is to improve your health overall.
Yeah, absolutely. I mean, when you lose weight, your blood sugar stabilizes. I've seen people coming off of insulin and just feeling a lot better. They can think clearer. They're not having as many issues as they had before. So I'm really glad that you're out there spreading the message. And I hope that the insurance companies specifically stop being so stingy and help us actually get better, right?
Yeah, I wish. I mean, if they would just realize that if they would treat the obesity, then they're not going to have to treat the diabetes and all the complications, even cancer. Obesity is really the number one cause of many cancers.
Mhm.
So many things that are expensive health conditions that we deal with. If we could just treat the obesity, we can prevent all of that.
Yeah, yeah.
Mhm.
I've seen the same like in my research, just looking from the inflammation perspective. It's like the weight just adds so much extra burden to our bodies, and it's just hard for it to clear all of those things out. So
Yeah, yeah.
I'm really, really glad that you're out there helping. From a treatment perspective, I know I asked you to come on to talk about GLP-1s, but there are other treatment protocols out there. So, like when you're talking to patients and you're trying to put together treatment plans, what are some of the things that you're looking for?
Yeah. So the first thing is, have they ever done anything to try to lose weight at all in the past? Have they tried making some dietary changes? Have they tried physical activity? Because a lot of patients haven't done anything, and there's different types of people. There are some people that they just want the medication because they feel like it's going to be easy, and then they don't have to change their diet, they don't have to exercise, the medicine will just do it
Mhm.
for them, which is not the case. And then there are other people who don't want medicine. They actually don't want to take medication, but taking the medication is necessary in some cases. They may have already tried the nutrition changes and the physical activity, and nothing has worked or nothing has been sustained. So that's the first step, is looking at their history. What have they tried? Then, based on their medical history, their family history, then we can decide, are they a good candidate for GLP-1 medication? GLP-1s are going to be the first line medication treatment for weight loss. So we do have other meds out there. There are other medicines that we prescribe, but if somebody can take a GLP-1 medication and is a good candidate for it, that's always going to be the preferred option because it does work the best. They all have side effects, which we'll probably get to later, but as far as effectiveness and really working with your physiology, at this point in time, the GLP-1 meds are going to be your best option.
So when you're meeting with a patient who hasn't really tried some of the food and exercise modifications first, like how long do you recommend that they try to get those things in place and be consistent before looking at medications?
Yeah. So that is really going to also depend on where they are. What is their state? How much weight do they have to lose? Do they already have a lot of complications of obesity? So if they're already in a state where maybe they're diabetic or very close to becoming diabetic, their blood pressure is high, their cholesterol is very high, they are having mobility issues, arthritis, joint pain, just because of all the inflammation and everything going on, that's somebody that I would probably want them to start a medication sooner rather than later. So somebody like that, if they are opposed to starting a medication right away, I would do a trial of lifestyle changes for 3 months. And you need strict changes and really sticking to the plan, reassess in 3 months. And if there really has not been much change or if things have worsened, then that's someone that I would strongly recommend medication for. If it's somebody that they're overweight or obese, but they're not really showing any of the obvious complications yet, then generally we'll do a trial of lifestyle changes for up to 6 months and then reassess and see. So it really just depends on where they are at baseline when they're coming to me.
Okay, great. I love that distinction between the two.
Mm-hmm.
Now, you did mention side effects earlier. So, and I understand
Yes.
everybody reacts a little differently, but could you
Yes.
share some of those that
Oh,
you've
yes.
seen and maybe some things you've recommended to help
Yeah.
manage those?
Yeah. I would say side effects is like the number one thing when people are starting GLP-1s. That's their number one concern. There's so much information out there online about side effects and so many things. So I would just say that not everybody gets side effects. The majority of people probably are completely fine and do not experience any side effects. People who do get side effects, it does tend to be limited. So it might be in the beginning until your body gets used to it and then they resolve. Sometimes we'll notice it with dose changes. We bump up the dose, you might have for a little bit, body gets used to it, goes away. There's a small group of people that do have certain side effects that last the whole time. And so in those people, we do have to weigh risk versus benefits. The most common things that we're going to see are constipation, nausea, sometimes diarrhea, and I would say heartburn, acid reflux. And these are usually a result of just the way the medications work in general. And so I can go into that a little bit. There's really three main mechanisms of GLP-1s, but one of them is the fact that it slows down gastric emptying. So this means that as you're eating, food is going to pass through your stomach, your GI system slower than normal. And in your stomach is actually going to sit there for a little bit. And so you're going to feel full sooner and you stay feeling full longer. So your appetite goes down. You're not going to be able to eat as much. But because of that slowing down, that's what can lead to the constipation. That food sitting there feeling can lead to the acid reflux, that symptom, or nausea. The diarrhea, that one I would say is not quite as common. And that one does tend to be one that's usually within maybe a first few days of taking the dose and then it resolves. And usually you don't have to, most people don't deal with that. But those are the common side effects we see. Some of them we can treat. Nausea, we can prescribe anti-nausea medications. Constipation, really, I'm going to recommend some lifestyle changes for that, increasing fiber. Sometimes we might have to use over-the-counter stool softeners and those kind of things. Probiotics, prebiotics are great for helping with that. So I would say the majority of people, the side effects are not severe enough to stop the medication. The benefits outweigh the risks and the potential side effects.
Okay.
Mhm.
Yeah, I've done just different reading out there, and some of the things that you read, it's kind of scary because you're like, where is this coming from?
Yes, and I will just say, so there's a common, people talk about gastroparesis, stomach paralysis. That's
Mm-hmm.
like a common thing out there. And so that is coming from that whole slowing down gastric emptying mechanism. Now, people who are diabetic, they are prone to having gastroparesis. They're prone to having that condition at baseline. Whether or not they're on a GLP-1 or not, diabetics over time can develop gastroparesis. So somebody like that, yes, they might be more prone to developing that. The average person who's using this for weight loss, it is extremely rare for that to happen. We just don't see it. So, of course, their studies are ongoing, but we've actually been using, this is another thing that a lot of people don't know. They think GLP-1s are new. We've been using them for over 20 years now. They have been in use for over 20 years. Original use was in diabetes. The first one was approved for weight loss 10 years ago. Maybe it might even be 11 years ago now. So since I have been in practice, I have been using GLP-1s for weight. So they're not new. So we have years of studies and seeing the effects on patients. And honestly, it's all been positive outcomes. So we're getting more and more indications and FDA approvals for these for other conditions. And that's a result of studying them over the years.
I'm really comforted to hear that because anytime I open up Instagram or I'm watching YouTube videos, all these videos pop up of all the celebrities with Ozempic face and
Yep.
oh, there must be something terribly wrong with them. And it just makes you wonder seeing that stuff, like what's really going on. So
Yes, yes. The media, they just love to sensationalize things. And Ozempic face, Ozempic butt, these are all the things that we see out there. And yes, when you lose weight, you're losing fat. And in a lot of people, that fat does leave your face. It can leave your butt. It can leave your breast. Those are the common areas. And you will get sagging of your skin. And the older you are, the more prone you are to that because these are things that happen at baseline, even if you're not on a GLP-1. So these things can happen. It's not the end of the world. There are cosmetic treatments available if it's something that's really bothersome to you. But again, the majority of people, they lose weight and they look like themselves. They don't look different. They don't look abnormal. If you lost a significant amount of weight, no matter how you lost the weight, surgery or medication, you might need some sort of cosmetic procedure after, skin removal, different things like that. But that's just what comes along with losing the weight.
yeah, yeah. It just happens a little easier with the
Mhm.
GLP-1.
Yeah.
Which is good because you're already stressed out enough trying to
Yes.
figure out how to do it all. So
Right.
I'm really happy to hear that. I know we've already talked about some of these, but are there any other misconceptions or rumors or anything out there about the medications that
Mhm.
that patients come to you asking
Yeah.
about?
Okay, yeah. Well, one is that it's a quick fix. So I can just quickly take the medicine, lose the weight, and be done. So there's two things to that. There are some people that their cause of weight loss, it could be something situational, maybe a stressful life event, maybe having kids, maybe hormonal, menopausal. So they may not have always struggled with weight and they got to a certain age, they gained weight and they had trouble losing it. Sometimes in those cases, yes, you can take that GLP-1 medication. You had to make the lifestyle changes too. You lose the weight and you might be able to maintain on your own. The majority of people, though, in this country that suffer from obesity, there's a genetic component to it. And it's probably something that they've struggled with most of their life from childhood. They've always been up and down with weight. These people, it really is a lifelong commitment. And people don't like to hear that. They don't want to hear that. But It's true. It's just like having diabetes or having high blood pressure. You might be able to control with diet, exercise, lifestyle changes, but most people do tend to be on medication for the rest of their life, unfortunately. And so it becomes part of your routine, part of your lifestyle. There's different ways to maintain. Some people will take it for a period, stay off for a period, get back on. There's no set rules to how you do it. But I do like people to understand that it is a lifelong commitment. And in order to sustain the weight loss, you might need to be on that medication for the rest of your life. And that's okay. There's nothing wrong with that. So I think that's one thing is people are always like, well, I don't want to be on this medicine for the rest of my life. I don't want to be on a medication forever. But it is a chronic condition. And as of now, this is really the best thing that we have. And who knows what will happen, what will come down the line, what treatments will come. But for now, this is really the best option. Other myths, there's, I think, just the different side effects. That's a big one. Blindness. There was a study that came out that linked GLP-1 use to a very rare type of blindness. And with that, it's a rare condition. The study is not very large, and there could be some issues with the study, but you have to look at, it's another instance of looking at risk versus benefit. So, I look at it, the very rare potential risk of getting this extremely rare condition that can cause blindness versus the high, well-known risk that we have of remaining obese and getting diabetes and having high blood pressure, developing cancers. So we know for sure that obesity causes these things. We don't know for sure that a GLP-1 is going to cause blindness. So people sometimes, I think, kind of look at things, they don't look at it in perspective. So that's one thing. But yeah, I don't know. Are there others that you've heard of that?
I think that covers the majority of them.
Yeah.
Yeah, I hadn't actually heard of the blindness study, so I just learned a new thing to be worried about GLP-1.
Yeah, I think that one came out last year, either earlier this year or late last year at some point. It was a very small study, so it's not anything that is honestly a significant concern.
Yeah. I've got a very good friend of mine who she's actually a type 1 diabetic. And she was diagnosed later than normal. And so she's been on insulin for a very long time, and she's lost so much weight, and she's put in the work, and it's just changed her life completely. And seeing someone I know personally, really that I've known her through this entire struggle, and just seeing how much of a change, it's so powerful. And that's one of the reasons why I wanted to learn more about it, because I'm not a doctor. I can't prescribe it, but I'm going to meet a lot of people on the nutrition side who struggle with weight and want to lose that weight. And so connecting with people like you who have used it and actually know what you're doing and feel comfortable going, okay, I'm not the expert, but I know someone who is.
Yes. Yeah. And that's a good point, because it's very rampant out here, people prescribing GLP-1s that are not physicians. And it's become, I don't know, it's just become the norm. And I don't know how and when it became the norm, but it did. I think because med spas started doing weight loss and started prescribing GLP-1s. And so non-physicians just started doing it in that space. And nothing against them. I am a med spa owner, so not all med spas are bad, but you just have to make sure wherever you're going that there is a physician or at least a nurse practitioner who is knowledgeable in these medications and in the physiology of weight loss and knows the things to check for, knows the contraindications, knows how to manage your dosing, can tell you what dose you're on in milligrams and not just in units. That's a clear sign that they don't know what they're doing. I have patients come to me from other places and I ask, well, what dose are you on? And they can only tell me I'm on this many units, what they drop in the syringe. That tells me nothing. And a lot of these places, they don't know. They don't know the milligrams that they are prescribing for people. So safety is very important. So that I definitely stress that if you can go to a physician and even better, a physician who has a special interest in obesity, that's even best because it is your life, and although the side effects are serious, effects are rare, complications can happen. So you want to make sure that you are doing it safely.
Absolutely. Like I do not want to watch some influencer on Instagram and be like, "Oh, click the link in my bio and buy my
Yes,
microdose."
yes, yes. And let me say something about that. So I've been seeing online a lot of people are buying peptides. They're basically buying these medications from I don't know where. I have no idea where they're getting it from. And this is just the regular, this is the public. They are not getting a prescription. They're just ordering it from probably somewhere in China. And they're learning from social media people how to mix it. They're buying saline or other things and they're mixing it themselves and injecting
Terrifying.
themselves. It's so dangerous. I mean, this is prescription medication. You would not just buy in blood pressure medication or antibiotics randomly from a foreign country and give it to yourself. It's the same thing. So they do it because of cost, which I understand. These are very expensive, but it has to be done safely.
Yes, yes, I
Mhm.
100% agree. I talk about that on the supplement side. Like
Yes.
there's so much you have to look out for there. It's like
Yeah,
supplements can be very helpful, but they're not always from a safe manufacturer. So
yeah,
it's a
yeah.
big point for me on the nutrition side. I do have one question from a weight loss perspective because some things I've heard people talking and when they think I'm going to lose weight, they think they're just going to lose fat.
Hmm. Yeah, yeah.
And that's a big one for me
Yes.
because working with perimenopausal women, we're getting to that age where our bodies are naturally going to start losing muscle mass. We're going to start having bone issues if we're not taking care of our nutrition and everything. And
Mhm.
then being on a GLP-1 adds a whole different spin to that issue. So I would love it if you could talk about muscle mass.
Yes, definitely. That is a great point. So when you are losing weight, yes, you're going to lose fat, but you will also lose muscle. And one thing that we have seen with these GLP-1 meds is that people do tend to lose more muscle more quickly than with other weight loss methods. And this could be because you are losing more weight with the GLP-1 medication. And it is a little bit more rapid than just say with diet and exercise. So that is key. And when I see patients and we get started on a program, one of the things is I make sure that we talk about how much protein they should be taking in daily based on their weight, and that will vary as time goes on, but they have to be getting in a minimum amount of protein to try to help with maintaining muscle, and they have to do weight bearing exercise. So you really want to be doing some sort of weight bearing exercise minimum 3 days a week, 20 to 30 minutes at a time. It doesn't mean you have to be in the gym lifting weights. If you can, great. But I tell patients you can buy wrist and ankle weights. You can get them online at Target, Walmart, all those places have them, and just go for a walk, but strap those weights on as you're walking. Pump your arms so that you're getting that arm resistance, and then put them on your ankles so you get that in your legs. So you have to do those things, otherwise you will lose muscle. We also are monitoring that. So that's another thing. You want to make sure that wherever you are going and getting your medication from, they're not just weighing you and looking at pounds. They should have some sort of way to monitor other components. And so here in the office, we have a scale that will measure your weight as well as your muscle mass and your body fat percentage. And so we're doing that monthly. We're looking at the numbers. We can make adjustments as needed based on that. So these are all things, important things that need to be taken into consideration when you're on a weight loss program.
Awesome. Thank you. I know just without having complications from obesity, just getting enough movement in can be difficult enough,
Yeah.
especially ladies of a certain age. We were raised to think that we just needed to do some cardio, and if we did a spin class or a yoga
Yeah.
session, we'd be fine. And
Yep.
I have over the last couple of years just started to enjoy actually weight training, and it's not easy for sure. I have a coach that pushes me because I know I won't push myself.
Yeah, it's hard. It hurts. It's uncomfortable. It's not fun. Nobody wants to do it, but it is a necessary thing because losing muscle mass, as you mentioned, as we get older, we're hitting that menopause, perimenopause stage. It's just complicates things. So you really want to try to maintain your muscle as much as possible.
Great, great.
Mhm.
One other question. We just talked about body composition, but in addition to that, is there anything else, like from a lab perspective or other health markers that you're tracking that would be important for us to know?
Mhm. So when I see patients at baseline, I do like to get a few basic labs. So we're going to look at your cholesterol. We'll look at your hemoglobin A1C, which is a test for prediabetes, a metabolic panel that will look at your kidney function, your liver function. I usually like to check thyroid at least once at baseline just to make sure that there's not a thyroid condition leading to your weight gain. And then vitamin D, I usually will check that also. So these are labs that, if everything is good and is great, they can be checked once a year. You could check every 6 months if needed. Now, if you do have abnormalities, depending on what these abnormalities are, you're going to want to be monitoring them every 3 to 6 months. And then the good thing is that, let's say things were not great. A1C was high, cholesterol was high. As we progress through the program and you are losing weight, we recheck, we are going to see improvement. It might not be the first time, but usually by the second time, there's going to be significant improvement. And that's great for patients to see because that is like the proof. Yes, they're losing weight and they can see it going down on the scale, but when you see your labs change, that also tells you that internally things are changing and things are getting better. So I do love checking those labs. Outside of those, there's really nothing we have to monitor per se with the GLP-1. Just making sure at baseline kidneys and liver is fine. That's okay. But we don't have to really check labs periodically just to monitor while taking GLP-1. So we're looking for the outcomes.
Okay. Okay, good.
Mhm.
Good. Less to worry about.
Yes.
We'll take it off the list. If anyone listening to this is considering or they're already taking a GLP-1 from a daily perspective, like what would you recommend that they focus on just for overall health and wellness?
Mm-hmm. Yeah, so they really want to make sure that so the nutrition is probably going to be the first side that I'm going to focus on, which, that's your area. I might be sending them to you. But I want to make sure that they are getting in enough protein daily, like I mentioned before. I also stress following a low carb diet. For many patients trying to lose weight, low carb, high protein seems to work very well.
I know
So,
people are crying right now hearing you say that.
yes, I know, but it works. It just
It
works.
does.
So, those are really the two things. I'm not super strict with like specific macro counting and calorie counting because I find that it's hard to maintain that in the long term, and some people just get overwhelmed with it. So, if they want to really focus on those things, that's when I will send them to a nutritionist to just maybe get a little bit more guidance with that. But general principles, you want to make sure you are eating because the GLP-1s, they do decrease your appetite. Some people forget to eat throughout the day. They don't eat enough. So you have to make sure that you are eating regularly, you're getting in enough protein, you're keeping your carbs low, and you're getting in that exercise. Those are the basic principles when you're taking a GLP-1. It doesn't have to be anything crazy complicated. That's it. That's really it.
That sounds pretty simple.
Yeah.
So thank you so much for coming on the show. I know I have learned a ton today, and I feel a lot more comfortable about GLP-1s than I did before we got on this call, because it's so easy to go down that rabbit hole when you're online looking at different things. And without digging into the studies and really spending the time, it's hard to know what's true and what's not. So
Yeah.
thank you for coming on and sharing. And I know we'll have links to everything in the show notes for our listeners, but could you share, if anyone would like to reach out to you and learn more, how we can connect with you?
Definitely. Yeah. So you can check out our website. It's going to be www.hibiscus.health. And from the website, you can book an appointment. You can find links to all the social media. Our phone number here at the office is 281-394-4959. I do have Instagram, Facebook, TikTok, YouTube. The practice pages are Hibiscus Aesthetics and Wellness. And I also have my own personal pages, which would be at Dr. Jacinta MD.
Awesome. Thank you so much for coming on the show today.
Thanks for having me, Lieah. This was great.
Thanks so much for joining me today on the Inflamed and Exhausted Podcast. If this episode helped you connect the dots or gave you a new perspective, I'd love it if you'd follow the show and leave a quick review. It helps more women find this message. Remember, healing isn't about being perfect. It's about staying curious, staying kind to yourself, and taking the next best step. I'll see you next time.